So, when did you know that Divine Smiles was the right place for your health and dental needs?
After I got the splint, the temporary splint over my lower teeth, I Googled Divine Smiles. I just Googled help me, dentist that helps with TMD. So I found it on a Google search, and I had been through so much, and I just said, it won't hurt to try. And met with the team. Everyone was very professional, very knowledgeable, and most importantly, very willing to explain the reasons behind everything, which was very important to me. But you don't know. This is an unknown. This is not something common. So it wasn't until he put the splint on my teeth and my migraines were just gone. After 2 days, gone. And then I decided, all right, this is the thing that's going to work for me.
All right, great. And having gone through comprehensive treatment, do you feel that others would benefit from such an approach? Yes,
100%. Because I've been dealing with migraine issues for over 20 years, and because I've seen a neurologist, multiple neurologists, and another dentist, and other doctors, and ear, nose, and throat, everything, I do know dozens of other treatments that I've tried, and this is the only one that has actually worked.
All right, and how has your treatment and your results impacted you physically and emotionally?
So physically, when you go from a daily migraine to no more headaches, it's quite life-changing, because it's not just the pain of a migraine, which is painful, but it's the energy drain. You just can't do much. And so after I finished work most days, in the migraine days, that was it, I'd be done. And I was on a lot of different painkillers. So I was taking painkillers every day, and I would have to wait till the end of the day because I'd have to work, and the painkillers affect your ability to reason, I think. And so I really I had no time for anything else. And it's physically and emotionally draining. And now to start to get that energy back, even my husband noticed that I was able to do more than one thing during a day, which was unusual. It sounds silly, but I couldn't go shopping and then go out to dinner. I couldn't do 2 things in a day. And now suddenly I can do a lot more.
Okay, yeah, that's great. And what can you tell someone who has been told that medication, soft diet, and a night guard are all that they can do to get pain relief?
That's not gonna work. So I can't even count the number of different medications I've been on, including ones to lower my blood pressure. There have been so many different medications. And I've had different types of night guards, a lot of different types of night guards. And I've never been told that a soft diet would do anything. I just don't understand how it would, because for someone like me who's clenching and or grinding, and the diet had no part of this whatsoever. This is me doing it during the night and during the day, clenching my jaw.
Alrighty, and what could you tell someone who is trying to decide between jaw surgery or full mouth reconstruction?
I don't know. I don't know the actual comparison of jaw surgery. I don't know what it entails. I do know that surgery is always pretty extreme, especially for someone like me, because anytime, I also have this other thing where anytime I get cut, my scar tissue goes crazy. And it causes other problems. So I try to avoid surgery. Also, anesthesia is never a safe bet. But this was certainly not something that I wanted to do, but the minute I had the result with the migraine going away, I was all in. I was like, this is what we're going to do. I don't know how jaw surgery resolves it. I can't say.
Yeah, and jaw surgery is tough recovery too.
Yeah, I don't know what it entails.
Yes,
But
you
this
definitely made
was-
the right choice. Yeah.
Yeah, this was not as bad as I thought it would be.
A lot of people say that. It seems a lot more difficult than it is, but. And do you take less medication since your treatment success?
I don't take any medications for it anymore.
That's great. That's amazing.
And I took a lot.
And have you told any other medical providers about your treatment success?
Yes, my GP, my endocrinologist, I think that's it.
All right, great. And would you recommend Divine Smiles to friends, family, and coworkers?
I already have.
Oh, great. We love that.
So yeah, I mean, when something like this happens, you want to tell people because it's such a big deal.
Yeah, of course, right? And last question, Deb, having experienced decades of symptoms without relief, what would you tell your younger self about available care and the future?
So don't just listen to your GP or your neurologist. If things aren't working for you, do some research on your own. And an initial consult is not a big deal. It's not time consuming, it's not difficult, and it's not expensive. So if Dr. Clancy thinks he can help you, I believe he can, because he did me. And so it doesn't hurt just to check it out and see how you feel about it.
All right, well, Deb, thank you so much for doing this for us today. This was great.
All right?
Yeah, that was great.